she has other, okay, and she has other, she's tumor marker C15-3, other markers okay. Her other only abdominal ultrasonography, other everything is okay. Only she has now uh, right now she has bilateral limb swelling, lower limb swelling, and upper limb swelling, and she has right, left chest, uh, left breast swelling, and with left axial lymphadenopathy. It is now we concerned about this.
Okay. So one quick question for you. Did she have radiation after she completed her chemotherapy for the surgery in
Yes,
2000?
she got on her right chest, on her right chest previous to 2009.
Mhm.
She was diagnosed, and 2010 she got proper amount of radiotherapy after chemotherapy
Do
in
you,
Thailand.
yeah. Do you recall when they did her surgery on the right breast, when they did the mastectomy? Do you know how many lymph nodes they took out of her axilla? Do you know?
At that time, she has total mastectomy in right chest, and with she has two lymph nodes in right chest axilla. It was stage T4N1 and MX, stage 3V at that time. And she
Okay.
has immunohistochemistry, her report was ER, and HER2. All three are negative. She is
Okay.
diagnosed triple negative breast cancer at that time, 2009.
Okay. Um, so here are a couple of thoughts I have because I was able to look at the report from the information that was sent. One speculation I have is the swelling that we're seeing in her upper limb. My feeling is that it may not necessarily be recurrence because what happens is up to maybe 10 years after people get radiation to a part of a region of the body, particularly the breast, sometimes they can develop late stage lymphedema.
Yes,
That's
that
what I,
it is lymphadenopathy, right side lymphadenopathy,
yeah. So that's one thought
axillary.
I have. The other thing is that if there's worry about recurrence on the right side, on exam, does she have anything on her chest wall or in that is palpable that you can feel?
On right side, she has no swelling. She
Okay.
has she has now swelling in left side,
Left
left
side.
chest.
Okay.
Yeah,
So
left. Yes, sir.
yeah, when I looked at the ultrasound that they did, they mentioned a hypoechoic mass or
Yes,
a hypoechoic finding on the left breast.
yes. Her chest, left chest has hypoglycemic mass, and also left side is axial lymphadenopathy.
Yeah. So my feeling is probably next reasonable step is to biopsy that mass
Yes,
that
yes.
you see on the
You
ultrasound.
already we already done core biopsy, and report will we got histopathology report, we got 22nd second October we will get from lab.
Okay. So my feeling is based on what the report shows, if it's consistent with a another primary in the left breast,
Yes.
then the question then becomes because she's 42, right? She
Yeah.
already had triple negative breast cancer on the right breast.
Yeah.
The question I would want to ask off the top is that if she had any form of genetic testing.
And I think it is better, but in Bangladesh this facility is not available. But I
Okay.
think BRC1, BRC2 is better for her. I think you
Yeah, I think
correct.
yes, I think it would be reasonable to actually do some genetic testing to figure if she has any
Ovary and other.
yes, genetic predisposition because it'll help us think about potential other
Yeah.
cancers.
Yes, you correct. Yes.
And then the question for her is, as far as treatment, if assuming this comes back as cancer, the biopsy that's done, based on size, she has probably two sets of options from a surgery perspective. So I would say breast conservation is reasonable based on the size of what we've seen on the ultrasound. And then the question would then determine, the question next would be, is she ER/PR positive, and is she HER2 positive or negative?
Yeah.
Because those things would drive whether or not we consider chemotherapy. And I would say it's always reasonable to consider chemotherapy up front if she's a chemotherapy candidate, based on if she says she's triple negative.
Yes, sir.
And then what that would do is give us some time to see how her disease behaves, right? So assuming this biopsy comes back as cancer, then my thought will be, the first step is to figure the ER/PR status and the HER2 status. Assuming she's triple negative again, then I would say my first step would be to offer her chemotherapy up front and see how the stuff in the breast responds.
Yes.
Because then we can incorporate breast conservation therapy later on down the line.
Yes.
So I think the important next two steps are, one, definitely I would get genetic testing for her if it's possible, at least the BRCA genes. And then I would also see what the ER/PR status is for what was biopsied, assuming it's cancer. And then if it's triple negative, then I would say chemotherapy first. If
Yes,
it's
sir.
hormone positive, if it's ER/PR positive, then you may want to do surgery up front and then consider hormonal therapy as adjuvant treatment later on. So her breast conservation will be along the lines of a, I don't know what you all use for needle localization, but you can use like basically needle localization for where the cancer is, and do a lumpectomy or partial mastectomy. And then based on what the axilla shows, either a sentinel lymph node biopsy, it's intraoperative frozen section.
Yes,
And
sir.
then if that's positive, then I would say in her case, I would dissect out the rest of her axilla.
Yes, sir. Yes, sir.
Hopefully that's helpful.
Yes, sir. It is our protocol.
Yeah. So
Our
that's what I would suggest as far as
we
planning
also
goes.
we also in Bangladesh do same things in here.
Okay. So that's good. Yeah.
Thank you, sir.
Do
Do you think, sir? I have a
to
question. Do you think she need, and previously she was left right chest right breast, now left breast. Do you think radiotherapy uh, after chemo?
Yeah. So my feeling about radiotherapy is as follows. One is that if she does breast conservation for the left side, then she would need additional radiation.
Yes, sir.
She
What will
does
be,
not.
sir?
Go ahead.
What will be dose? Radiotherapy, and how much is dose?
Well, I would. It depends on her age. They can do probably some hypofractionation. So I would probably do. I would consider, say, treating her up to. I'm trying to think off the top now. So I'll do her in 5 fractions, and then probably do hypofractionation and do doses for a total of up to 36 gray. I don't know how you guys. Yeah, I don't know how you guys measure gray.
every day I am interested
Sir,
to
how much dose? Please repeat, sir.
So I would say up to 36 gray.
36 May,
Yeah.
not 40, not 45 or 40. 42
Well,
or
I would say 40 or 45 is that if you include the axilla. If you include the axilla because there's disease in the axilla, then I would go that high.
okay. So as she is a TNBC, if against TNBC we got dose is 36 or 40 or 45 or 42, which is best?
Well, I think it has to do with toxicity, right? Because I
Yes,
think
sir.
the higher doses you go, the more toxicity they have. So if I'm trying to manage that toxicity, I'll go lower. And the reason why I'm saying that is because she already had some sign that she had lymphedema on the right side. So that's why I would go with a lower dose if I give radiation. One situation she may not need radiation is if, say, you do a mastectomy on the right side, on the left side. If you do a mastectomy and margins are negative, and then you have the axilla dissected out and you have less than 2 lymph nodes involved, she may not even need radiation at all.
Okay.
Okay. Thank you, Dr. Jia. I think you may introduce your patient with the dear doctor. Are you interested to talk our patient or with the observation?
Yeah, I'll be happy to.
Yeah, our patient is here.
Sure.
Please. Our patient.
Hello, how are you?
Hi.
How are you doing?
Yes, fine.
Okay. Do you understand what I'm saying? I don't know if she understood what I said, but I'm not sure how much. Yeah. Yeah.
হ্যালো ভাবি,
জি,
আপনি ওই যে এতক্ষণ যে ডাক্তার সাথে কথা বললো, আপনি কি বুঝছেন কিনা এটা জিজ্ঞেস করতেছে।
না বুঝতে পারিনি।
বুঝতে পারে নাই।
আচ্ছা,
অত বুঝতে দরকার নেই, এই জন্য ওনাকে দেখো আর ওনার কমপ্লেন
She doesn't understand. I can break it down in simpler terms. I don't have to use anything complex.
ওকে।
আপনার হাতটা একটু দেখাতে পারেন।
Uh, if she's okay with it, like, yeah, I don't know how she feels about doing an exam. Sure, I can look at.
He can look at it if you don't mind.
Yeah. Yeah.
Right side.
Really. Yeah, that's significant. Another thing, I don't know if what's potentially available is we have these things called lymphedema therapy and treatment, where they measure out the arm and look at dimensions of the arm, and they use basically compression devices to help with the swelling and push all the fluid back into
Okay.
her armpit.
Okay.
Yeah. And how long has it been swollen like this for?
কতদিন ধরে আপনার এই হাতটা ফুলছে?
এটা 3-4 বছর ধরে।
About 4 years.
4 years.
Okay, so it's been this swollen for the last 2 to 4 years. Okay. And has she ever tried, we call them compression stockings?
So did you try any kind of like a
মাসাজ না?
Yeah.
no, আটকে রাখে দে
ও,
compression করে রাখে।
হাতের মধ্যে কখনো ওই যে কম্প্রেশন দিয়ে আটকে রাখে যায় করছিলেন এগুলা? হাত বেঁধে গিয়ে করে।
Correct. She not done. She not done.
Yeah, so she should do
Doctor,
that.
she not done though.
Yeah, she should try that because I think it will help with the swelling.
Complaint. She complaint bandage never she use.
Okay.
পেনের কথা বলেন।
And
No,
there are exercises, maybe it's something I can find online a video of. There are exercises they can do for the arm
Okay.
that can help with the swelling in the arm.
Okay.
Okay. So I'll try to find a video that I can share of exercises they can do for the arm to help with that swelling. So a combination of, yes, a combination of compression devices like compression stockings and exercises can help with the swelling. One other thing that can be done that's helpful is we sometimes will inject in between the fingers to find the lymphatic channels that are bleeding back and figure out there are surgeries you can do to connect the lymphatic channel to the venous channel to reduce the swelling. They do it in the armpit. I mean, I do some of those, but yeah, I don't know if they have that to do that over there for her. But the ways to treat it are exercises, compression stockings, and then if that doesn't work as well, the last thing to try to do is surgery to connect the lymphatic channels to the venous channels, because it does look like lymphedema from radiation and like dissection of the axilla that developed over time. Do you know if she has any abnormal skin rash anywhere or
No, sir.
that arm?
Yes.
Okay.
She has no abdominal skin rash.
Okay.
Sir, another I have mentioned, she both lower limb swelling up to knee joint, and she has D-dimer is rise. At the point I saw her about D-dimer, D-dimer.
Yes.
It was
D-dimer.
normally it was 0.05.
Mhm.
She has 0.5. She has at time 6, more than 6.
Hmm.
Do you think DBT, deep vein thrombosis, or other thing, or
That's another thing to think about. So I would say I would get an ultrasound also of the upper extremity and all the swelling she has to look at all her venous system to see if she has like a clot. To see if she has a deep venous thrombosis. Correct. So I would do an ultrasound to see if she has, so ultrasound of the arm and the lower extremity that are swollen. They can look at all the venous system to see if she has a deep venous thrombosis.
we also advise her duplex study of lower limb.
Yes, I would. Yes, I would do both lower limb and the upper extremity as well.
Yes, sir. Thank you, sir.
Of course. Do you guys have any other questions, thoughts?
Sir, she has last 3 years, she has no physiotherapy, like no exercise, his limbs, arms, exercise.
Yes.
I give some advice, do regular exercise of arm.
Yes, of course.
I think
there is some gap within these 3 years. Follow-up treatment, there is a gap in follow-up treatment.
Last 3 years.
Last 3 years.
default, sure, default and follow.
Now is suffering from pain very much in the hand and the lower part of the legs.
Lower limb, yeah.
Pain, pain.
I think the compression would help. The exercises would help.
Maybe help.
Can she describe what kind of pain she's having? Is it pain from because of their limb is heavy, or does it feel like shooting pain?
Now pain is the most complaint.
Okay.
Sir, painটা শুটিং কি না হয় স্যার, পেনটা বেড়ে যায় কিনা খুব হঠাৎ করে বেড়ে যায় কিনা, শুটিং পেন কিনা স্যার, হঠাৎ করে বেড়ে যায় কিনা জিজ্ঞেস করেন স্যার।
বেড়ে যায় না পাটা?
হ্যাঁ, হঠাৎ বেশি বেড়ে যায় আবার একটু কম।
Yes sir, it's a shooting pain. Sir, it is
one thing I try sometimes, it's that helps with shooting nerve pain. I don't know what it's called there. It's called gabapentin.
Gabapentin, yes, it is available in Bangladesh.
Yeah, I would try that because that tends to help also.
Yes, okay, we can advise her. Gabapentin, 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 both are available in our country.
Okay.
Very good. Therefore, I think combination therapy to Rifadjia will be help us. I think treatment schedule, investigation schedule, or any suggestion from your concern to Dr. Rifadjia.
Okay, sir.
I think total treatment for the patient.
I think truly the next steps are.
I think total treatment including your observation, suggestion, recommendation.
No, I think that's what it is. So one other thing to consider are, I think nutrition is a very important part of the healing process. And I can send you
exactly.
So I can send you specific information about some of the nutritional protocols we use for women that are survivors of breast cancer.
Yeah.
So I can send you that information. We have like a protocol we use for women that we put them on a nutrition regimen for survivors of breast cancer. So that would be the other piece of advice I would add is the nutrition piece.
Yeah. Dr. Rifat, if you have any question or query to our doctor.
Sir,
yeah.
Use it about compression bandage, compression. How much time she will use this compression bandage?
Oh yeah, you can use that almost indefinitely until the swelling gets better. Yes. So when they do the measurements, because they're different sizes.
Masses can done. Masses.
Yeah. Yes, massage works too. Yes, to like sort of soothe and like push the fluid back. Yes.
Massage and compression bandage.
Yeah.
Compression bandage. How many times in a day? 24 hours. How many times should?
No, I usually tell people that once they're free to do it, I do like 2 or 3 times a day at the minimum. Yeah.
Yes. Okay. Bandage.
Yes.
How many times it's keep? She will keep it this bandage, compression bandage keep.
Oh,
How
how
many
long?
times?
How many times in a day?
How long? How long time? In 24
Oh, how
hours.
long?
They can keep.
Can keep it on. You can keep it on for as long as possible. So some people, because it's a little bit compressing, they feel uncomfortable. You can keep these things for as long as possible. Yeah, there's no real time.
Okay. Her comfortable period. She how many? Who is she feel better? How many times? That's okay.
Yeah,
Thank you.
of course.
Okay. So, Dr. Rifat, it is okay, I think.
Yes, sir. I am okay, sir. It's okay. I can got her. Everything
And,
about.
আপনাদের কোনো I think it is a good and great initiative from USA to Bangladeshi patient. And thanks a lot, dear doctor. Many thanks to you. Have you any question or query to us or to the patient, to our consultant? Any more question or not?
No, I think I don't have any more questions. I think I got a good sense. Yeah.
You already took a note, right? All the advice he made. Dr. Zia?
Dr. Zia
We-
note নিতেন না সব?
We all. I got yes, sir. I got almost maximum information. After core biopsy will proceed everything. Now we have
Okay.
concerned about his lymph node everything. For this, I will talk after this meeting. I will talk with my patient.
Okay. Okay, sounds good. Thank you.
All right.
So
it's nice
thank
to
you
meet
so
all of
much.
you.
On behalf of Bangladesh FAD, thank you so much
Of course.
for the participation in the discussion. I think it will be helpful for our patient and to set for the future better way.
Of course.
Thank you.
Thank
Of
you so
course.
much.
We can close the session now.
Yeah, we'll close the session.
We'll close the session.
Yes, sir.
Thank
Sir,
you so
আমি
much.
Nice to meet you
রুল
all.
স্যারের কথা বলবো
Okay.
স্যার রুল স্যারের কথা বলবো স্যার একটু কথা বলবো
Not your cousin, is he? The same.
Yeah.
You guys have the same last name.
Ji. Mother,
আমরা বের হয়ে যাই না?
ওকে
thank you,
আমরা
Mother. Thank you so much.
মহাতাব ভাই আমি বাসায় যাই আপনার সাথে কথা বলবো অনেক
ওকে স্যার
জি বলেন।
স্যার একটা হলো এখন ওই স্যার গাবাটা অ্যাড করে প্রি গাবা যেটা পাওয়া যায় বাংলাদেশে ওটা অ্যাড করে দেন স্যার যেটা বললো প্রি গাবা স্যার
আমরা কালকে তোমার সাথে কনসাল্ট করে টোটাল একটা ট্রিটমেন্ট শিডিউল
স্যার ওই একটা কম্প্রেশন ব্যান্ডেজ ওগুলো পাওয়া যায় শাহবাগ মার্কেট ওগুলো কিনুক আর একটা মেসেজ
বলে রেফাত আমি
স্যার।
মনে করি tomorrow we'll be sit together তুমি
Yes, sir.
ট্রিটমেন্ট
স্যার।
গুছিয়ে নিন
স্যার
ঠিক আছে
স্যার
সেটা ওখানে হোক বা ডেকে
স্যার।
এখানে
স্যার স্যার স্যার
সেটা বেটার হবে
ওকে স্যার
ডিসকাশনটা তুমি গুছিয়ে নাও
জি স্যার 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 জি স্যার
ঠিক আছে
ওকে
দেন একটা টাইম করে আমাদের এখানে আসলে ভালো হবে পেশেন্ট
স্যার।
থাকলেন উনি থাকলেন আমরা থাকলাম ঠিক আছে দ্যাট ইজ বেটার
স্যার
কি আপনি কথা বুঝতে পারছেন তো আমরা তাকে ডাকি এখন পেশেন্টও থাকলো বুঝিয়ে কথা বলবে আমার মনে হয় হ্যাঁ
পেশেন্ট না থাকলেই ভালো
না পেশেন্ট থাকতে হবে তার বুঝে দিতে হবে না থাকলে ভালো কেন কালকে তাহলে কালকে কখন হুইচ ইজ দ্য বেটার টাইম আগামীকাল
স্যার 8টার পরে তাহলে 8টা ওনার
আমাদের এখানে অসুবিধা নেই
8টা ঠিক আছে 8টার পরে স্যার
আর ডেট তুমি এখানে আসলা
স্যার
টোটাল ডিসকাশন তুমি শিডিউলটা রেডি করে নিলা ঠিক আছে দেন পেশেন্টে থাকবে
স্যার আসলে এখন স্যার সবচেয়ে ভালো হয় স্যার আমরা আসলে কোর বাইপসি নিয়ে আসার পরে আগাই স্যার
হ্যাঁ
স্যার স্যার
জি
2 তারিখে আজকে তো 25 তারিখ 2 তারিখে কোর বাইপসি আসবেন কোর বাইপসি পরে আমরা আগাই উনি এখন ওই যে ব্যায়ামগুলো কি করতেছে কিনা স্যার শুধু স্যার আপনি শুধু প্রি গাবাটা অ্যাড করে দেন ওনাকে প্রি গাবা খাবে 75 করে স্যার
আচ্ছা
প্রি গাবা 50 করে দিয়ে দেন স্যার 50 করে দুবেলা বিডি ডোজ
আচ্ছা এটা দেবুন ওকে
আপনি দিয়ে দেন স্যার এটা আপনার পক্ষ থেকে দিয়ে দেন
প্রি গাবা না
প্রি গাবা 50 দুবেলা খাবে সকালে একটা রাতে একটা
ট্যাবলেট প্রি গাবা জিএভিএ
জি স্যার জিএবিএ
কত মিলিগ্রাম
50 মিলিগ্রাম বিডি রোজ দেন স্যার
1 + 0 + 1
স্যার
এটা চলবে
আর একটা স্যার উনি শাহবাগ থেকে একটা কম্প্রেশন ব্যান্ডেজ কিনবেন, শাহবাগ থেকে সার্জিক্যাল ইয়াতে একটা কম্প্রেশন ব্যান্ডেজ পাওয়া যাবে স্যার, ওটা বেঁধে রাখবে, বেশি টাইটও না লুজও না, মাঝামাঝি রাখবে স্যার, খুব বেশি টাইটও না লুজও না, যতক্ষণ বেঁধে রাখতে পারে।
ডিসকাশন করে কথা বলবো না। ওকে, থ্যাংক ইউ
স্যার ওনাকে ওনার কাছে ফোন নাম্বারে অসুবিধা ফোন দিতে বলেন, আমি কাল পিজিতে থাকবো। শাহবাগে একজন চলে আসলে হবে স্যার, আয়সা ওখান থেকে নিয়ে নেবেন।
ঠিক আছে, ওকে,
থ্যাংক ইউ স্যার, ধন্যবাদ স্যার, আসসালামু আলাইকুম।
সার্জারি
আল্লাহ
জি,
আল্লাহ হাফেজ স্যার।
হ্যাঁ, থ্যাংক ইউ।
আসসালামু আলাইকুম।
নিবেদ বন্ধ করো। আচ্ছা,
আল্লাহ হাফেজ।
আল্লাহ, থ্যাংক ইউ সো মাচ ফর জি।
সার্জারিক্যাল লাগবে
সার্জিক্যাল ব্যান্ডেজ, স্টিল ব্যান্ডেজ
না, সেটা আছে, এমনি তো সার্জারি লাগবে।
সেটাও কালকে ওষুধ আরোপ পরে এই জন্য আসতে বলে।
না, ওই যে বলতে চাই যে ওই ইতিহাস রিপোর্টটার জন্য করতে চাই।
সেটা তো করবেই, তবু তো চলো
আমার নাম্বারটা রাখুন 017 321 47658 যে কোনো প্রবলেম আমারে বলুন, যে কোনো প্রবলেম। আমি
সেলিম শেখ, হার্বাল মেডিসিন।
স্যার আমি তো বিল্ডিং এই থাকি, ওই বাসায় নাইলে আমি সারাক্ষণই অফিসে থাকি। সকালে আসি এইটার উপরেই, এটার উপরে ওই মাথায়, এই টোটালটা আমার অফিস, কিন্তু আমি ওই মাথায় বসি।
মানে পুরো ফ্লোরিং বিস্তৃত
না, পুরো
একসময় যাবো
আসবো না, আমি তো এই আপনার কাককে দর্শকের জন্য আমি আর কি